Today's workshop, Supports Intensity Scale Adult, or SIS-A, Assessment Overview. I'm excited to introduce you to Jessica Bernard, the Deputy Director of Payment Reform at the Department of Disabilities, Aging, and Independent Living. Jessica has been with the state of Vermont for 8 years, 3.5 with DAIL working on payment reform. Prior to that, she worked in the human services field for over 15 years as a case manager, community support worker, youth behavioral interventionist, employment counselor, and children's crisis bed support. Welcome, Jessica, and thank you so much for joining us and for all of you joining us today for this presentation.
Great. Thank you, Diane. So I will share my presentation. I'm Jessica Bernard, as the intro said, Deputy Director of Payment Reform. Okay, hopefully everybody can see my slides. So we are here to talk about the independent assessment of need. So that is the support intensity scale for adults. The SIS-A is what I'll probably call it throughout the rest of the presentation. So Vermont is using the SIS-A. It is a standardized tool, so that means everybody gets asked the same questions the same way. It also means that there is one rating scale that everybody is going to use who administers it and everybody who takes it. So being a standardized tool, the benefit that we see there is that we know that the administration of it, the way that people take it, is going to be similar from person to person, agency to agency, all over the state. And as many of you know, the Centers for Medicare and Medicaid Services, CMS, they give us money for services because they're part of the federal government. They have rules that we have to follow. And so one of the rules that they have is that we have to use an independently administered assessment tool. So that means that people or agencies who create the budgets and do the assessments, they can't also deliver services. And so that's avoiding conflict of interest in case management. I think people have also probably heard a lot about that. That won't be something that we cover today, although there are some areas that cross over, this assessment being one, right? That's why we hired Public Consulting Group, or PCG, to do the assessments, because until we have case managers who don't deliver services, we had to find a way to be able to get the new assessment tool to be administered by people who aren't also providing the services. And in Vermont, we don't have another option. And we at the state chose the SIS-A because it's a standardized tool and it can be used to indicate and make budgets in the future. And so once again, the fact that it's standardized means that the assessment is going to be done the same way. Obviously, it'll be different depending on who's in the room and answering the questions, but everyone's going to get asked the same questions. The needs are going to get measured in a similar way. So it won't matter where you get services, who you get services from, how experienced somebody is. So we hope that this means things will be more fair when planning for services and identifying what needs somebody has. And so the SIS-A is an assessment that looks at the support that a person needs to do everyday activities. And so by looking at the supports the same way for everyone taking the SIS-A is going to answer all of the questions using the same rating key. But sometimes folks, one of the first questions they have is, well, there's an employment section in the SIS-A. Why do I have to answer questions about employment if I'm not working, I'm not looking for work? Maybe I've never worked and I'm not interested. Maybe I'm retired. Why do I have to answer those? And we do ask that everybody does have to answer all of the questions, even if they don't seem like they're applicable or that they make sense for you, because that's going to give us an overall score and an overall idea that what would the support be if you needed it. So for folks who maybe they're not working and they would need a very high level of support if they were, the reason we want to know this is that's going to help contribute to that overall assessment of need. It's going to give us an idea that maybe they have a higher need across all of the areas of their daily life, whatever that means for them. And so that's why we do ask people to answer all of the questions, even if they don't seem like they make sense for you. And one thing I just always like to ask people, remind them that, the SIS-A is not a test. Sometimes we hear folks say, oh, I'm signed up to take the test, or I have to take this test, my SIS-A test. And it's an assessment, it's not a test. You can't pass, you can't fail. It is getting at an assessment of need. And so we don't want anyone going in thinking that they could somehow do it wrong, or that they couldn't pass their SIS-A. So if you do hear someone say, refer to the SIS-A as a test, we just ask that folks might consider just reminding them it's an assessment. It's a needs assessment. And so if anyone hasn't taken a SIS-A yet, we'd like to just share a little bit about the process for the referral. So PCG will receive a referral form from the agency. It's a lot of demographic information, so they'll need to know information about the person ahead of time to start setting up the SIS-A appointment. And so really, if there's anything important that someone should know that we want to communicate to the assessors ahead of the assessment, this is a place where it would be really good to remind maybe the service coordinator, whoever's setting this up, that, hey, they don't want to answer these questions, or they're not comfortable about talking about this topic, or they want me to answer these questions for them and they want to leave the room, or maybe someone has a trauma history. So these are all things that if you can let PCG know either during the referral period through the service coordinator, it would be really great so that the assessors can try to make the assessment as tailored to the individual as possible. So if there are things that are difficult to talk about, just knowing that there may be some sensitive questions and how can they approach, they really appreciate it because they want this to go smoothly. We want everyone to be as comfortable as possible. And the PCG scheduling team, they are going to call from a number that's up there. It's 1-623-277-5999. So that's the scheduling team calling. So I think it's flagged as like an Arizona number. Most people don't pick up phone numbers from people they don't recognize in this day and age, right? So it's totally fine. If you don't pick it up, they will leave a message. And then if you want to call back the scheduling team to start scheduling this SIS-A, finding a time that works for everybody, you'll want to call them back at the 1-833-930-3543 number. So even though you're going to get called from the call center number, there is a specific number to call back if you want to schedule. So we want to make sure people have both of those. And then we want to make sure everybody knows that in addition to the individual being assessed, there needs to be at least 2 people who can join as a respondent. That's what we call the people who are helping to answer questions for the assessment. So 2 people. They need to have known the person for at least 3 months. That's the bare minimum. We really want people who know the individual. They could be family members, guardians, friends, shared living providers, staff members, people who are close to them. We want to make sure that the people who are there to help with the assessment, to help answer the questions, they really should know the person well. And so we have had some questions come up in the past where, well, I have a new service coordinator. They've only been working with me for a month or 2. Should they be at the assessment? And we would say it's always up to the individual who they want at the assessment. But if that person were to join, it would be really more for them to hear the conversation and maybe get to know you. They wouldn't be someone who should be answering questions because they probably don't know you well enough and they haven't known you long enough. So it's up to the individual who's there, but definitely make sure that the people who are invited really know the person and can help answer the questions. And then People right now, and we plan to continue this going forward because it's worked really well since we all learned to kind of work remotely and do things more online than we ever have before. So people can choose if they want to take their assessment virtually or in person. It's completely up to the individual. So if you do choose a virtual option, you will get a link, a date and time reminder with a link to the assessment, I think a couple of days before the assessment is scheduled. And at that point, you'll be hearing from the assessor. And that's also a good time. I like to just remind folks that if there is something the assessor needs to know about, once you get that information, you'll have the email of the assessor. You can always say, hey, so-and-so doesn't want to answer these questions. They want to leave the room during that part. Little things like that, or we need to be really sensitive about this. So there's another opportunity to share information with the assessors at that point so that we can make sure that anything that they would need to know, we can try to set it up ahead of time. So what does the SIS-A ask about? So for folks who haven't seen it or haven't participated, the SIS-A has two main sections. So section 1 is broken into 2 parts. So we have the exceptional medical and behavioral support section. So section 1A is going to ask about medical support needs, and section 1B is going to ask about behavioral support needs, mental health as well. And then section 2 is bigger. That's the support needs index section. So this section is going to ask about supports needed for everyday activities. So needing supports around the home, taking care of hygiene, getting in and out of the community, staying safe, seeing family, friends, managing their money, working, taking classes, things like that. And we do have a link here. I think the links are going to be sent out after, but we do have a sample of our SIS-A assessment up on the website. It was filled out with a fictitious person. So there are some examples in there just so we want everyone to be able to see the questions. So the main goal of having an example up for people is that you can see the questions ahead of time so that if there are things someone doesn't feel comfortable answering, we can figure out how to get the information, or so that people can be prepared. People have time to think about what supports they need for all of these different areas. So I just want to say the goal for having that up there is to look at the questions. Because it's not a real person, I think sometimes the examples, you might kind of say like, well, why did they need that support there but not there? It's not a real person. So we don't want you to look at that as trying to, assess the rating scale. And if this were, me or my loved one, don't try to pre-score, but please look at the questions in terms of how it is that you want to be prepared and feel like you know what is going to be asked during the assessment. And so this is the rating key for section 1. So the questions about medical and behavioral or mental health supports, you're going to be asked to rate it, and you'll work with the assessor. They'll help you understand the rating key, and that a score of a 0 is really no exceptional support is needed for that. So it's a condition or behavior that's not, really an issue. There aren't extraordinary supports that are needed to manage the medical condition or behavior. There's a score of 1, so some exceptional support is needed. So continuously aware about the support need. You have to be vigilant about it, monitoring, maybe it's something you have to check in about. Episodic activity support, so something that doesn't happen every day, but it happens now and then, or it's not something that happens across all environments, so maybe it's a support needed at home, but not in the community, or vice versa. And then there are extensive exceptional support needs, so that's the high score for this key is a 2. So that means that the supports that are needed are intense. They might be hands-on support that occur frequently. They may need active supports in all environments, active supports that maybe take up a lot of time and energy. So that's the rating key for the medical, behavioral, and mental health questions. So sections 1A and 1B. And then I want to show folks just a little sample. So this is from our sample that's on our website. So I wanted to make sure people know this is edited to fit the page. There are more questions. I just can't fit everything on one page. So definitely check out the link if you want to see all of the questions. So some of the questions here that we ask about during the Section 1A medical portion of the SIS-A, does someone need inhalation or oxygen therapy support? Do they need help with postural drainage, chest PT, suctioning, oral stimulation, jaw positioning? So you can see we kind of go through a lot of things that we may find that when people have medical support needs, these are a lot of things that, we try, AAIDD, the American Association on Intellectual and Developmental Disabilities, they've created the SIS-A. So this isn't a state created tool. I think they tried to identify a lot of supports that are typically needed for folks with IDD, intellectual and developmental disabilities. But as you can see, they did make sure to add this section at the bottom that says, management of other serious medical conditions, specify. So if there's a medical support need that was not asked about during the medical section, there's an area here at the end where someone can say, oh, there's also this medical support need. And it can be rated and people can, add notes. Please, specify. There'll be a description. They'll want to know what that looks like for the person. And so there is an open-ended area so people can add something specific if it wasn't asked about on any of the previous questions. And then the medical section will have its own score here at the bottom. So section 1A is its own section with its own score. And then scoring for section 1B, behavioral. So these are the behavioral supports, mental health support questions. And once again, this is edited. There are more questions. We just wanted to pull out some so people would have an idea of what's being asked. So does someone need support around prevention of emotional outbursts? What kind, what's that? Some support, no support, extensive support, prevention of assaults or injuries, prevention of property destruction. Does the person need support around maintaining their mental health treatments? What does that look like? So there's the score and then the notes. And so once again, just like the medical section, there is a section. So if something hasn't been asked about in the specific questions, you can list it here and you can score it and you can add notes so that we don't miss something just because we couldn't think of it because it wasn't thought of to be on this list. And then there's a score for this section too. So section 1B, the behavioral, will have its own score as well. And so now we'll talk about the second section, section 2. That's our support need index section is what it's called. So there are 7 sections to this piece, so it's bigger. There are more questions. There are 57 questions total. And this section does have a different rating key that's going to get a little bit more detailed. And so the 7 different sections are home living activities. So this is where we'll ask about any supports needed for bathing, dressing, making food, housekeeping. There's a community living activities section. So wanting to know supports needed around shopping or visiting friends, really getting into the community. We have lifelong learning activities. So learning new things, using technology. If someone were taking classes, this also might be really important. Work activities, so employment, so learning new job skills, using those skills, working with other people. There's a health and safety activities section as well. So, what supports are needed to take care of your health, like taking medications, things like that. And then there's a social activities section. So, supports around friendships, maintaining friendships, socializing, doing activities with other people. And then advocacy activities. So what supports might someone need for speaking up for themselves or others, managing their money, staying safe. And so here's the rating key for section 2. So if we remember section 1, A and B, it was a little bit of a more simple rating key, whereas it was looking for one score. It was, 0, 1, or 2. And so now this is going to ask people to think about a few other things. So this is going to be a little bit more detailed. So when asking about supports that people need for, let's say, bathing, we're going to want folks to think about first, we want to know the type of support. So what kind of support should be provided? Is it none? Does the person not need any support? Do they need some monitoring support? Do they need verbal or gestural prompting? Do they need some partial physical assistance? So they need some help, but they can still do part. Or do they need full physical assistance where someone is really assisting them with completing the task in its entirety? And then we also want people to think about the frequency of support. So if someone needs help bathing, how frequently is that support needed? So is it none or less than monthly? Is it monthly? Is it weekly? Is it daily? Or is it hourly or more frequently? And so sometimes, this is going to change depending on the task because, you probably aren't bathing hourly, right, every day. Whereas there may be other tasks that people are doing where they do need that support hourly for a different task. So we really want to get the detail on, how much, what's the frequency of support for each of these activities. And then the daily support time. So on a typical day when support is needed for each question, we're going to ask folks to think about how much time should be devoted. So when someone does need help with bathing, is it none? Is it less than 30 minutes? Does it take 30 minutes to less than 2 hours? Does it take 2 hours to less than 4 hours? Or is this something that's taking 4 hours or more? It's taking up a lot of time. And so I want to make sure folks know this is a very different way to look at support needs. People don't typically think this way. If you're either family member, a caregiver, a support staff, or as an individual thinking about the supports that you get, this is a very different framework. And so I want to make sure that people know we recognize that it's a very different way that we're asking people to think about their support need. And we don't want people to feel like they have to track what does this week look like? I've got to write this down. We don't want people kind of feeling like they have to do a diary or track things. We really want people to know about this ahead of time so that you can get into that frame of mind, but we certainly wouldn't want anyone to feel like they had to, come prepared with some sort of outline of what they do every day. So we don't want anyone feeling like they've got homework. This is something that you'll talk through, and the assessors will help you kind of think through examples so that you can come to a conclusion about what seems typical. And for times where we have folks where one day someone might not need a lot of support, another day they might need more support, we ask people to rate based on the most support needed because we want to make sure that it's there. Because if it's going to be a higher level of support, 2 out of 7 days, we want to make sure that we know what that need is. So we've talked with our assessors, but we want to make sure you all know too that please answer questions. If the support need varies, answer it based on what the highest level of support typically looks like. And so a lot of people say, okay, well, I've taken the SIS-A, I have my report, so now what do I do with the results? And so right now, we really encourage people to please use the SIS-A, please look at it. There's information there. Sometimes there's information that feels new because we just never asked before. So it might be helpful if you're making a crisis plan, a communication support plan, behavior support plan, any person-centered planning activity, your ISA planning, all of that, really there could be information there. So please don't file it away. Make sure that this is something that people are looking at. And then a big question is, how could we use the SIS-A score in the future? What is this, why did we transition to it? What is this? What's the goal? What's the intent? So we can take the scores from the medical section, the behavioral section, and then the support need index score. So that's section 2 with all of those questions. And we have a 6-level of support framework. And so you may not be familiar with the 6-level framework. And so this was made from our 500-person sample that many people may remember or may have heard of. Maybe you haven't. But when the SIS-A rolled out in July of 2021, we were, the goal was that we could get 500 people to take the SIS-A so that we could then go through and create, well, first identify how many different levels of support are needed in Vermont. And so if anyone's familiar with the current needs assessment that Vermont created, I think they break down need into 4 areas, right? So it's support needs are none, minimal, moderate, significant. And so when we then looked at our SIS-As, we also pulled in some second editions because we had a transition when they switched over to the second edition. So we said, how many levels of support does it seem like we have in Vermont? Where are there kind of really distinct patterns that we see people have similar needs? Not that people don't have individual needs. People absolutely have individual needs, but there were certain things that people had in common. And so we found that actually we think there are 6 levels of support in Vermont. So kind of expanding it previously from the way that we were looking at support needs with the Vermont assessment tool. And so we think that there are folks who have low general support needs. So they have some general support needs. They don't have high medical or behavioral or mental health support needs. They might have some, but they're probably pretty typical medical or behavioral or mental health needs. So folks with low general support needs, you know, they have some general support needs in any of the areas that are asked about, but overall, they probably also have a lot of independence. Then we have folks who have moderate general support needs. So they need a little bit more assistance with, you know, probably some daily living activities, maybe getting out into the community, all of the different things. They're going to need a little bit more help than folks who have low general support needs. And so just like that previous group, people who have moderate general support needs, they don't have high medical or behavioral or mental health needs on top of, in addition to, I should say, their moderate general support needs. They might have some, once again, right? Many of us do, but it's not the focus of the supports that they're getting. And then we have folks who have high general support need. So these are folks who are needing some sort of support with probably a lot of areas in their life. There are still areas, you know, that they're independent. There are things that they can definitely do for themselves, but they're needing more support than folks in the lower moderate general support need group. And then we have folks with very high general support needs. And so similarly, they have more support need than the low, moderate, or high general support need folks. So they're needing a lot of support, probably with most areas of daily living. And once again, they don't have high medical or behavioral or mental health needs. They still might have some, once again, because we all do. It's just that their general support needs are very high, and that's the focus of probably what they need. Whereas then we do have a group of folks who have high medical needs. So they also have regular general support needs, right? Those everyday support needs, but their medical support needs are so high that that's actually probably going to be the focus of keeping them safe, keeping them healthy. And then there's another level for people who have high behavioral or mental health needs. And so once again, like the medical group, these are folks who also have general support needs as well, but their support needs around their behavioral or mental health needs are probably going to be the focus of how we want to make sure they're getting what they need. Their supports are probably going to be centered around a lot of addressing the behavioral or mental health supports. And so we want to make sure that they are getting what they need as well. And so you can see the scores from the SIS-A help to tell us typically what support groups people are going to fall into most of the time, right? So this may not be exact for everybody, and we'll talk a little bit about that in a few minutes too. But so folks who have lower general support needs, they're going to see their support need index score for section 2 up to 71. Folks who have moderate general support needs, their scores are typically going to be between 72 and 88. Folks who have high general support needs, their scores for Section 2 are going to be between 89 and 106. Folks who have very high general support needs, their SNI, Support Need Index score, that's that Section 2 score, they're going to typically see their score of 107 or higher. And then folks who have high medical needs, we're typically going to see them scoring a 7 or higher in the medical section. Folks who have high behavioral or mental health needs are typically going to score an 11 or higher in the behavioral section. And so this is a framework that we were able to get by doing that sample with the assessments in the beginning. And we work with a firm called HSRI, Human Services Research Institute, who are able to do the actual analysis of looking at everything, putting it together to see where people had similar support needs, to help us understand that we actually needed 6 levels of support. So we needed more than we were kind of previously thinking about. And then I want to take some time to look at the report. So these are the scores. So this is, once again, this is kind of edited. So when you actually get your report, it is going to look different. Everything's not just on one page like this, but I wanted to put it together so we could look at all the pieces together. So this is, so like we saw earlier, in the medical section, it's going to have its own score. So for our sample here, our fake person, Juniper, she scored a 4 for the medical support needs. So she has some medical support needs, but they're not really at a high level. And then in terms of her behavioral and mental health support needs, she has a 5. She has some support needs, right? We can see that, but it's not something that scored very highly. So these are things that we want to be aware of. We want to support her around. But that's its own section as well. So medical section has a score, behavioral mental health support section has a score. And then this down here is where we can look at the score for the support need index or Section 2. And so just want to go over how to look at this, because this is a table that doesn't always make a lot of sense, because it's new. It's nothing that we've really ever used before. So it's going to tell you each section. So you're going to see the home living activities, right? So that's one of those sections. It's going to give you the raw score. So 42. So for Juniper, if you just went to Section 2A, you just added up all the scores for all the sections, it would give you a raw score of 42. And so the raw scores for each section are, it's helpful. There's some information there, but not every section has the same number of questions. So I think lifelong learning activities has, I want to say 9 questions, and home living activities has 8 questions. So it could appear that lifelong learning activities with a raw score of 48, it seems like, well, maybe more support would be needed there, because it's more than the 42 that we have on the raw score for home living activities. But we have to take into account the fact that we don't have the same number of questions. So there are more points that are available for the lifelong learning activity section. So that's why they do a standard score. So a standard score puts these into a format where you can compare the sections against one another. So when we look at the standard score, this is going to tell us that, so actually for lifelong learning activities, supports needed, so her standard score for Juniper is 6, whereas here for home living activities, it's a 9. So Juniper actually might need more support in home living activities rather than lifelong learning activities. It's just the raw score doesn't really give the full picture because there are more points available. So your standard score, if you want to know how to use it, it's to compare each section against one another. The percentile, that's going to tell us, in terms of all people with IDD who have taken the SIS-A, Juniper needs more support in this area than about 37% of people with IDD who have taken a SIS-A. So this is all of the SIS-A kind of data. It's not Vermont specific. So, if someone thinks it's helpful to look at, great. We're not using it in anything for any of our frameworks. but it is information that's just provided as part of the SIS, so we want to make sure people know what it means. And the confidence interval is at 95%, so the tool is very reliable. It's measuring what it's intending to measure, and that it's doing it fairly accurately. If it weren't, the confidence interval, the range here between 8 and 10 is based on the standard score. So the standard score is 9. That's what Juniper has for her standard score. Because this is a very reliable tool, we're very confident that their standard score of 9 is correct. But if it weren't, it probably wouldn't have much more variation between an 8 and a 10 for a standard score. So it would be measuring very close in the event that it, for some reason, wasn't measuring as accurately as the tool intends to. But a confidence interval of 95% means that it's a very reliable tool. And then you'll see, oops, sorry about that, folks. So you'll see here the total raw score. Once again, there is a place where it just gets added up. Same with the standard score. But what we do use for the example we just had around the levels, those 6 levels of support. So the SIS-A support need index score is 85. And so that is taking all of the information from section 2. So it doesn't include medical, it doesn't include the behavioral, those are separate, they have their own scores. It's just section 2, and coming up with the overall support need index score for an individual. So for Juniper, it's an 85, percentile 16. And so that means that we see Juniper as, if we go back to our framework, for SNI score of 85, she doesn't have any extraordinary medical or behavioral support needs, right? Medical would need to be a 7 just to indicate someone has a high medical need. Behavioral mental health supports would need to be 11 to indicate that someone has a high behavioral or mental health support need. And her SIS-A support needs score of 85 means she has a moderate level of support need. And I think that was, obviously, this is a fake person, but I think if you do read through it, that was the intent, that there are a lot of things that Juniper can do independently, and there are still some areas where she needs support. So she was found to have a moderate level need for support. And so I will stop just to, this is a lot of information. So does anyone have questions about the scoring and how to read the report? Okay. And so a big question is, will my services, will my budget change? So we are making sure to let people know, we are drafting a payment model that is trying to connect the SIS-A score. So the medical section, the behavioral, that support need index score, to a budget. So we know that this change is very stressful. People are worried about their services, they're worried about their budgets. They don't want a change to happen that could negatively impact them. And so we want to make sure people know that we are not trying to cut budgets. Our funding has not been cut. The DS program has not been cut. So this is not something that we're looking to kind of assess people and say, okay, well, now you're going to lose services, supports, or a budget. That's not the intention. This is not a cost-cutting activity. Our goal is that we want people to continue to get the services that they need. But we do want to acknowledge that with a new assessment tool and our level framework, so it's possible that people could, based on their assessment, see that, well, it looks like maybe your needs are higher than they've been measured in the past. So there's the potential that some people could see their budgets increase. We also know that then the opposite is true. So if someone's need seems to be measured to be less than what it had been, is it possible that somebody's budget could be lowered or a reduction in a budget or service? And so we know that's the biggest fear that people have. And so we want to make sure people know that what we're trying to create is based on what Vermont does now. So the level framework, the budgets that we want to attach to hopefully get people the services that they need. We're looking at what people receive now, right? So what's been allocated and what's been used. We have to look at both. But we're looking at, what do people typically need when they have this kind of level of support? If someone has a lower or more moderate general support needs, what are the services that they're typically getting? What does that look like when they have high general support needs? What does that look like when they have really high medical or exceptional medical support needs? So we're using that information now to try to create budget funding ranges for each of those 6 levels that's based on what we see people needing now. So I just want to make sure people know that we're not doing this in a way where we're kind of just coming up with arbitrary or unconnected funding mechanisms. So we're looking at what's in our system now, because that's going to be the best indicator of what people typically need. But no tool is perfect, no process is perfect. There are always people in our system now, as there will be in the future, who just, might have a higher complex need, or they might need a specialized service, or they just might need something more than their budget allows, right? That happens now. And people go when they have a funding request. And so we want to make sure people know that we are also building in somebody's budget planning range. If that isn't going to meet their need, we're going to have an exceptions process. So we want to have a way for people to ask for something that they need if it's not either funded based on the limitation of their budget, or if it's they need a specialized budget. We want to make sure that people know we're going to have a process where people can say, yeah, you know what, I need this, and it's more than my budget can afford. And so here's my request for whatever that is. It's going to be different for different people. So the hope is that most of our budgets that we're going to draft will be adequate to meet the need for most people. But once again, we know nothing is perfect, and we know that we're going to have an exceptions process, because we want to hear from people if there's something that they need. We don't intend this to just kind of be a one and done, here's your notification, things are changing. We want to make sure people get the supports that they need. And then another piece is that we're adding more context to the person and their support needs. So in addition to the SIS-A, we're creating a context document where we're looking at things from on the individual about their support needs across all different environments. And so it's hopefully going to help the person-centered planning process. There are some areas in it that we want to flag so that we can say, if somebody needs 24-hour supports, or somebody needs 2-to-1 support, or a unique staffing pattern. Maybe someone has criminal justice involvement. And so there are a lot of things that they're able to do on their own, but they need specialized staffing, and that's going to be something that they need a higher budget for. So we're creating a context document so that we have some areas that we hope we'll be able to flag to say, let's take a look, let's make sure this person gets the budget that they need. But also, in addition to that, it's going to provide more information about who the person is, what do they need, and what about their environment around them, or the people around them, who are they? So we want to make sure folks know that that's being developed. We have a standardized assessment work group who's developing that. It's been in the works for about 1.5 years now. So it has obviously state staff and providers, but we also have parents of adult children who receive services. And we did have a few individuals who received services. Unfortunately, we've had some folks who've left the group. And we did have some advocates who unfortunately also have left the group. Bill Ash was on this. I think a lot of people know who Bill Ash is. He moved, he retired. So unfortunately, he's no longer on the group. But so this is something that really hopefully captures the perspectives of multiple people so that we can try to have a supplement to the SIS-A so that we can get a rich picture of what somebody needs. And then we always like to remind people, even though we'll have the exceptions process, people will always have the right to appeal a decision, file a grievance, but appeal a decision. Those rights are always going to exist anytime someone has a Medicaid funded service. That will never change. That will never go away. So we want to make sure people know that that's going to remain. That would never change. And so what comes next? So CMS, we talked about this a little bit, but everyone will need to have a needs assessment to receive home and community-based services. That is the current rule. That's not a new rule, but so we want to make sure people know that that does mean everyone will have to have a SIS-A. So people who deliver the services can't do the assessments or make budgets. That's why we have PCG doing the assessments. That is part of why we're transitioning to conflict-free case management. And the change to a new payment model and conflict-free case management, we are going to try to make those changes at the same time. So we're not putting our system through two very big changes back to back. Right now, we're aiming for July 2025 to kind of start those processes. There's obviously a lot of work happening behind the scenes. I can't speak too much to the conflict-free case management project, but obviously we don't have anyone identified yet. So we have some things that still have to happen, but we do want to make sure people know we're looking for July of 2025. So a little over a year from now, before we start to see these changes happen. And so everyone who gets home and community-based services, sometimes called HCBS, sometimes called Waiver, they'll need to do a SIS-A assessment at least once every 3 years. Starting in mid-2025, a case manager will make sure to do a review every year to make sure somebody's needs haven't changed, because for some people, 3 years, there won't be a change in most of their needs supports. But for some folks, it can change. It can change quickly, or it can change gradually. And we need to do a check-in every year to make sure that someone doesn't need to do a new SIS-A earlier than every 3 years. But at a minimum, we want people to do it once every 3 years. And then, of course, if someone has a big life-changing event, maybe there's a health event, maybe somebody, just has a diagnosis that wasn't there previously. Support needs have changed. Maybe there's been a change in living situation, and someone now needs to go from living with a unpaid caregiver to living with a shared living provider. And they're needing a lot more support because it was a really traumatic transition, especially if it was something that happened due to a crisis. So anything like that where somebody's support needs may have changed, we do want people to take the SIS-A once those changes have happened, rather than waiting for year 3. And then DDSD or DS and PCG, we meet with stakeholders every 3 to 4 months. So we try to do stakeholder engagement sessions. These slides are actually from our most recent stakeholder engagement session. So it's very similar to what we're doing now. So we're doing that, typically quarterly to try to provide updates, hear feedback, answer questions. So these engagement sessions are the flyers that we send to agencies. We also share them with our stakeholder groups. So I send it to the State Program Standing Committee, try to send it to, anyone else. So even though we have some folks from BFN who are on the State Program Standing Committee, we try to make sure that we've got folks who can spread the word as much as possible. So we ask our agencies to do it because they're really connected to everyone receiving services. But we also, anyone who was willing to share the flyer, get the word out about the engagement sessions, we really appreciate it, because this is, I don't have 3,300 phone numbers and email addresses, and I can't sit down and have this conversation with everybody. So the more we can get the word out and have people come together for sessions like this, it's really helpful for everybody, I think, to try to get the information. And then so just trying to help people have an idea of, by mid-2025, people who get HCBS or waiver services will have at least one SIS-A assessment. So we actually have people who will probably have 2, maybe even 3. So if they were part of the original sample that came out in 2021, they're going to have another SIS-A before we transition. And then so we have folks who will have more than one, but we know people have to have at least one by the time we transition. Every service provider agency knows the number of people who need to have an assessment. They know who they serve. They know how many people. We've helped break that down so that everyone has a monthly goal for people they need to refer to take the SIS-A. So we kind of came up with a schedule to give them an idea of how do we do this so that everybody gets their SIS-A before we transition. And so even though we worked with them to create these kind of schedules that give people an outline of how we can get everybody assessed on time. Individuals still can decide when they want to take the SIS-A for this first period. So if you hear from your service coordinator that, hey, we'd like to schedule your SIS-A for July, what are some good times? And you say, gosh, we're traveling a lot, or I have a sick family member that I'm doing a lot with and I need to support. July is really not good. Could we look at September? That's an okay conversation to have. It's really okay for people to say, like, I need to do this at a different time. Can we look at, putting this off? But everybody does need to do it by mid-2025 so you can have that first SIS-A and have an idea of what the needs are. And I think I already kind of made that third point. So if you did do an assessment early on when we rolled this out in 2021, you are going to have an opportunity to do one again. And we will have budgets drafted for each level of support in 2024. We're going to have public comment periods so people can see the changes. They can tell us what they think. We are just at the beginning of that. And so I hope we can schedule some public comment periods, town halls over the next couple of months. We don't have them scheduled yet. We do need to put a lot of this into plain language as well. And a lot of the explaining kind of the budgeting process, it's complicated. So we want to make sure that it's going to be accessible and it's going to be in plain language. So we're working on that now, but we will have some upcoming town halls and then an official public comment period. So we want to make sure folks know you are going to be able to see these ranges and how they get put together. And if you've had a SIS-A, you might be able to start thinking about what does this mean for me, for my family. And then when we start transitioning in 2025, we will have plans for how do we want to communicate with people who their budget, if there was a change and it's not adequate, we will have a process. We don't have one yet because we're a little far out, but we will have a process to be able to hear from people to make sure that when we transition, everybody does have the supports that they need. And then this is the resource list. So wanted to make sure that you had this really easy, accessible. These are links to our website. So there is a SIS-A respondent handbook, that sample SIS-A that we saw some of the excerpts from, some of the samples from. There are some videos about the SIS-A that are from AAIDD, the people who created the tool. And then there's also just some payment reform documents. So we wanted to make sure you had links to our website so you could quickly get to some of these things if you wanted to look at them, if you haven't seen them already. We do ask agencies to try to go over some of these things with people before they take a SIS-A. We want people to see the SIS-A ahead of time. We want people to see the respondent handbook, to watch the video so that they feel prepared. But knowledge is power. So you all can share these resources and make sure people have them before they take the SIS-A as well. So please, please, please share these widely. And then that is the end of the presentation. So I will stop sharing. We can go back. I will happily put it back up if folks have specific questions. But I thought it might be helpful to stop sharing so we could see each other in case folks want to talk.
Thank you so much, Jessica, for this great information. That was a very comprehensive presentation. And I'd like to remind everyone that the information will be sent out to you if you registered along with the recording. And I would like to just take a moment before we do questions and comments to ask people to complete the survey that I believe is posted in the chat. If we could just take a minute to do that, that helps us with our grants and planning and helps us to improve in our work. And so we'll just take a minute to do that, and then we'll move into questions and comments. Thank you. Okay, thank you, everyone. I think I'll go to the chat first. And I know we also had some questions sent in. I will read the comments. It says, just find this. I've done this assessment with several of my young adult children. It seems like the questions can make it hard to distinguish once people have a moderate level of support needs. Some of the questions seem to result in a similar score, even with vastly different levels of needs. And I'm not sure if there is a better way to answer what we're missing, what we're missing.
I don't know if the person is on. So if you are on and you would like to jump in, I want to make sure I'm understanding the question. So it sounds like
Kaylee, do you want to speak more to your question?
Hey there.
Hi.
Okay, so it seems like sometimes as we're answering for one of like a young adult child of mine is a quadriplegic and he's medically complex, and those needs are counted under the medical sections. But some of the others, when we're talking about things like housekeeping, um, and you know, the answer is you're going to do it for him. It seems like sometimes that isn't entirely capturing the needs versus one of my other young adult children who might only be moderately intellectually disabled, but does need more hands-on time. But overall, the needs that I provide are going to be greater. And it's the scores kind of don't reflect the greatest needs some of the time, and I'm not sure if it's the way that we're answering the questions that we've been advised to answer them, or if it's something else I'm missing. But once they seem to hit that level 4, it's all level 4 of the needs. So I'm not sure if that's part of why as well.
And so this is a great example of a time where I would be happy to set up time to meet with you to actually look at the SIS-As if it's helpful, so we could really kind of do specific examples. I think in general, where they're probably also capturing that medical need outside of the medical section, like you referenced, is saying that, well, you're going to have to help do things for him. I think you used that pronoun. So that's going to capture that higher level of need for the adult child that you described as quadriplegic. So you're probably going to see, my guess is that they have a high medical need and they might fall into the high, that medical support need, extraordinary medical support need category. But then they also have the general supports too. Whereas maybe one of the other kids that your adult children that you're taking the SIS for, it's possible that then you're going to see they have high general support needs as well, but maybe they don't have the high medical support. And so I think that's where the SIS-A is hopefully going to identify the differences in support need. And if there are some high medical needs that one of your adult children needs, sure, they may have some similar support needs for everyday living. It looks different on the individual level, but I think I'm guessing it's going to pull apart some of the medical stuff, and then that's the support that probably is going to be focused on, but they still have the general support needs. So I don't know as though that's a detailed enough answer without being able to look at the individual results. So I want to keep that on the table. If you want to find time, my email's on the slide deck. Please email me. I would be really happy to kind of go through so that I'm not talking hypothetically, and we could really actually look at what the scores are looking like. So I want to offer that.
Thank you. I will probably reach out when I have time.
Okay. Yeah, I understand.
Looks like we have a question from Jen. Do you want to ask your question?
I do. Jessica, thank you very much for again hosting these and your other. I feel like I pick something up every time I learn something new, or maybe it's just sinking in. We have not taken the SIS-A yet, but my question is, if my son currently has a clinical line but sees a private clinician and would like to have his private clinician attend the SIS-A assessment.
Mhm.
And yet there's been no planning for that at this point, let's just say, so I don't know if there's going to be funding for that. How would the clinician time be accounted for the professional input, considering we're not retired and are going to be on Medicare, so we don't have private insurance like we used to that could cover some of that. That
Mhm.
question makes sense?
It does make sense because, yeah, you're bringing up an interesting point, because if it were an agency hired therapist, their time is kind of taken care of, right? They're paid a salary, so they could just join. But because this is someone who is a provider in the community, right? Like I could go and try to get services essentially. That is something that isn't paid for through, because it's not a therapy session, right? So even though your child has the funding for therapy, it sounds like, it wouldn't be a therapy session. So how does that clinician get paid? Is that what you're asking?
Well, I think his is more, at this time is more, so they're included in the monthly meetings because of his complexity, so that everybody's on the same page. So
Okay.
I think that does get included, in my understanding, as part of the clinical line.
Based on the rate that they're kind of paying them there.
Yeah, I guess so. I don't know what Medicaid. It's all news to me. So
Yeah.
I was just kind of curious. I was just thinking like, okay, so and I know he wants this person there.
Mhm.
It's just like, okay, how do they get funded, or do we have to go back to our agency and say, hey, for the SIS-A, do we have to go back and ask for some additional funding for them to participate? Since they have, I'm gonna say 14 years experience.
Right. Yeah, it would be great for them to be there. So I think it would be good not knowing what the contract between the agency and the clinician looks like. If that's allowable based on the contracted work that they have, that would be probably the first question is that written in anywhere? Is the clinician willing to do that? So that would be where I would start. And then if there's a funding request, that would be something they would need to go through the current channels. So if they needed more money for some reason, or is it a one-time funding request? I think it would depend on, does the contract allow for it? Which it sounds like it does if they're coming to monthly meetings. Is the clinician willing to do that? Since they don't work for one of our agencies, we don't get to tell them.
No, I think she's willing. It's just a matter of,
Good.
I'm just worried about, like, I know how it would have been paid for before, but that's not an option anymore. So I was just curious. So I'll go back to the agency and talk to his program manager.
Yeah, talk to the agency and see if that's something that's allowed under the contract,
Okay.
because that kind of gets outside of what I can speak to and what our policy allowances are. So
Okay.
yeah, but I think it would be really good to ask. And I don't know if our director would kick me under the table if she were here, but you can always, if it's applicable, you can always ask about one-time funds if there's a specialized request.
Okay, thank you.
Yeah.
So I know we're over time. It's 3:35. And I know that Jessica said that she could stay a few extra minutes if there are more questions. But I also know that some folks may need to leave now. And just as a reminder, that we have many more interesting workshops coming up, and you can find details about those on our homepage on our website, VermontFamilyNetwork.org, along with links to other recorded workshops. We have tons of information on our website, and getting connected with us is easy. You can follow us on Facebook or join our closed Facebook page if you are a parent. We actually have two closed Facebook groups, one for all parents of children with disabilities and special health needs, and one for those with adult children. You can also sign up for our e-monthly news, or check out our YouTube channel. We're here to help. Please contact us by phone or email. Jessica, thank you very much. We are very grateful for you being here today and providing this training for us. And thanks to everyone who joined us today. We really appreciate it. And I guess we'll just hang on for a couple more minutes to see if there are any lingering questions that people would like to ask.
So Diane, this is Karen. I believe that there were quite a few questions submitted before. Probably there's not enough time for Jessica to answer all of them, but there were a number submitted in advance.
So I know, and thank you, Karen. I know in the past when that we've received written questions, if Jess, if we sent those to you, perhaps would you mind kind of responding, and we can send those responses out with the information, or we could try to address some of those now, whichever.
Whatever you prefer is fine with me. If
Okay.
you do need to send some to me to respond to in writing, that's totally fine. I will just need a little bit of time. I'll be away at a conference next week, so there might be a little bit of a delay. So, which is if that's okay with folks.
Okay. So I know that so this you did talk a little bit about how, what happens after reports are received, and someone did have a comment about profound disability is maybe poorly represented. That came from a parent. I'm just going to read the questions so people have a kind of a sense of what questions came in. We had a question about how difficult it is to get a Medicaid waiver, and for that I would just refer someone back to their agency to kind of talk about how they might qualify, if their child's or young adults needs meet a funding priority, and what that looks like in terms of qualifying for home and community-based services, also known as a waiver. We had a question about, someone was curious about answering questions about how much support is needed per week to do things that they can't do, like to go to the store. Another question from a parent, is the SIS-A limited to only identifying 9 to 5 supports? And what if 24/7 supports are needed? My guess is that includes 24/7, Jessica.
I think in that second rating scale, right, where we talk about, so if something is happening 4 hours or more, and how often is it happening, that does get at the frequency where you will see higher scores the more support somebody needs. But getting back to the context document that we talked about a little bit, that is going to be one of the areas we want to flag. We really want to pull out if somebody needs 24-hour supports, 2-to-1 staffing. So that will be an area that we want to make sure we're really identifying in case the SIS-A doesn't represent it as well as we hope it does. But this is going to be a way that we will pull that out by including it in our context questions.
Okay. And then another question, how does SIS-A results inform the funding an individual receives for needed supports? What else informs that funding determination? I think you addressed that as well.
I hope so, but.
Let me just take a look to see if we have any raised hands. I don't see any right now. And I have a lot of thank yous, Jessica, in our comments. Let's see. Not seeing any more questions. One question, if I could ask a question. I know that there are some children and youth in Vermont who receive home and community-based services, and you had mentioned, that this is for adults, the SIS-A, and I think that's age 16 and up. Does that mean that for under 16, that previous assessment would be used that address the 4 areas that you referred to?
So, right. So we have a much smaller population of folks who are under the age of 16. And so there is a SIS-C. It does exist. We've seen it. We've looked through it. Where payment reform did not bring on the SIS-C because that population of folks, I think it's about 50, give or take 10. That's not a big enough population to say it's a different tool than the SIS-A. It's different questions, different scoring. So we wouldn't be able to make the same kind of level framework in budgets if using the SIS-C. So that's not something that we're able to do with payment reform, but the SIS-C is out there. And so I think if people have questions about it, we wouldn't be able to make budgets or levels of support based on the SIS-A. So I think folks are looking at keeping the needs assessment. And then if anything were to change with the SIS-A, that would be that would be a department policy rather than a payment reform decision, because we wouldn't be able to kind of do the same framework and the same analysis. So we're not looking to create budgets around the SIS-A.
Okay, thank you. That's really helpful because we do have families of under age 16 who receive HCBS, and if they hear the adult piece, they might have questions about that. So thank you.
I would be curious if folks have thoughts or feedback about, would it be easier to do the SIS-A so that people are ready for something like the SIS-A? So I think if folks have thoughts, we're always open to hearing them. But from a payment reform standpoint, we just weren't able to work with the SIS-A the way that we would with the SIS-A because our population is so small.
Thank you. And it looks like we have a hand raised. Holly has a question.
Yeah, hi, thank you so much. I was just wondering, with the context document that is being worked on, if the people drafting that have factored in communication challenges, because it strikes me that the SIS-A doesn't really address doesn't ask about communication per se, other than to say, in a social context that someone would need help communicating. But in general, like for example, my son has very limited language, and a lot of what drives his support needs is scaffolding, is just his inability to understand a lot of what we are saying to him. So he needs intensive support, and that drives behaviors as well. So I'm just wondering if the context folks, if you agree that communication is something that's really kind of outside the purview of the SIS-A, and then insofar as that's my understanding, is that something that the context people could be thinking about? And is there a way for just ordinary outside people such as myself to communicate or at least monitor what's going on with that context committee, or have any contact information to sort of give input to that process? So that's a bunch of questions, but thank you very much.
No, I really appreciate you raising that, because communication is critical, and it's a big part of someone can't communicate, how can we meet their needs? And so we did create a supplemental question that gets asked with every SIS-A around communication that was embedded, I think it was January of 2023. I don't remember. So if your family member took it before then, you may not have been asked. It is on our website. So we have a communication question that we actually worked with the Vermont Communication Task Force to create. So it's part of something that everyone has to answer during the SIS-A. It's an addendum or supplemental question. But yes, also for context, we do have folks who are very, very, very interested and support the fact that communication is sometimes overlooked or sometimes not put at the forefront. And we can't possibly, like I just said, you can't provide support if you don't know what somebody needs. And so, yes, it's been woven into the context document, and will continue to be something that folks are really reminding everyone to keep in their forefront of their thoughts, and as we create all of these documents. In terms of being able to connect with them, I don't know if you know them already, some of our members, Susan Yuan, who's a family member, she's a parent of an adult child, and Mary Giori, she's a parent of an adult child. And I know that they sometimes, I think from what I've heard, they're often getting feedback from folks who are in their different social networks. And so I think, but it's a great question. So maybe that's something that when we're able to, we could bring it to VFN to get some feedback on. We brought it to GMSA to get a first draft kind of, what do you think? And we've gotten some good feedback. So maybe when we do another round, if folks at VFN would be interested, we'd be happy to probably, add you to the list of folks who might be able to give us some feedback and some suggestions.
Thank you, Jessica. It's a couple minutes. I know I was supposed to remind you at 3:45. I know you have another meeting to get to. There's a question, just a brief question, if I could ask in the chat, is the SIS-A a requirement for payment reform?
So it is a requirement. It's a Medicaid rule that everyone has to have a needs assessment to receive HCBS services. And we as the state have chosen the SIS-A. So by mid-2025, everybody does need to have taken the SIS-A. It will be part of HCBS funds waiver services. So if you're receiving HCBS services for DS, it's just for developmental services. Everyone will have to take it.
Thank you very much, Jessica. This has been extremely informative. I really appreciate it. Thanks everyone for joining us.
Thank you for your time. I really appreciate it.
Bye-bye, everyone. Thank you.